Now launched in 2014 with 41 fellows, the Nigerian Academy of Pharmacy has grown over the years to over 100 fellows, with the investiture of 14 new fellows this week. The president of the Academy, Prince Julius Adeluyi, said that the Academy is all about delivering quality healthcare to the patient. The keynote speaker of the event, pharmacist Claire Omoseye, also touched on the opportunities that are in the pharmaceutical industry, especially when it comes to locally produced drugs and equipment that Nigerian pharmacists and other healthcare professionals can take advantage of and eventually export to other African countries.
The fact that in the health sector, from time to time, you have the challenge of unnecessary competition, which sometimes may lead to the neglect of the very reason why we are health professionals, the patient. We preach for a patient-centered healthcare service. And we call on all the other health professionals to team together, because when we team together, we are better and stronger to serve the generality of Nigerians. And you can see that the work of the Academy has brought together the very best in the profession. There is no use waiting on the government or calling on the government ceaselessly to do this for you, do that for you. We're encouraging our profession and members of the profession to see what in their togetherness they can do for the profession.
During COVID-19, we saw there was insecurity for drug supply. There wasn't access to medicines. There wasn't access to medical equipment. And it just showed that we didn't have health sovereignty as a nation. So as pharmacists, we have a responsibility to ensure that people get access to quality healthcare. And that starts by having local produced drugs in Nigeria, such that, we're not dependent on any other nations. There's a lot of healthcare reform by the present administration to be able to unlock the potentials of the private sector, to reduce our importation and dependence on imported drugs, to go from 70% of importation of drugs to at least 60% of it, And to be able to do this, we need to create the enabling environment. We need to have physical and non-physical policies.
We must stem the tide of our young ones in terms of capacity building who are leaving the country at such a fast rate. Like I said here, an average of 10, 15 pharmacists leave the country every day. That is really very regrettable. And you know how much it takes for the government to train a pharmacist? But we're training and exporting these persons to some other economies who have not contributed to what it takes to train a pharmacist. So we will work closely with government and work with us, discuss with ourselves how we can stop colleagues from traveling and make good use of what we have.
In medicine, we cannot move away from ensuring that collaboration is strong. The pharmacists, the doctors, the other health professions. Till we come together, we will not solve the huge problems in the healthcare space that we have in Nigeria. So I am happy at the keynote lecture today, which spoke about collaboration, spoke about the fact that if we're going to really move in Africa, we really need to change our mindset and start to recognize how great we are and speak to the positive that we want to see.
If you are not on the table, you are on the menu, meaning that as pharmacists, we must ensure that we are at the decision-making center when decisions that concern pharmacy are being made. If we are not there, then we become the menu on the table.
I'm actually happy to be admitted into this High Ecolian Association, and I know that there's a lot of hard work and there's a lot of expectations for us, on ways to see that we improve our profession and see that we take it to greater heights. So we're ready to work, and we're planning to put in our best.
I know from my experience that pharmacy is going somewhere in Nigeria, but we have not arrived. And a lot of things need to be put in more, but there is a lot of prospects for us. I will contribute my quota even as I joined the academy.